and he bumps right into
It's
April's
another
shower
start to
maker.
the day in the Landry
things
home
that-
with twins Jackson and John Paul. Anna and Justin tried for 2 years to get pregnant. When in vitro fertilization became the last option, this couple knew it carried a 35% chance of having twins.
I was fine with having twins. I knew that there was a possibility.
Dr. John Stormont with Fertility and Women's Health Center of Louisiana says there is a science behind the decision over how many fertilized eggs or embryos to implant during an IVF procedure.
It depends on the patient's age, the quality of the embryos, and the will and the desires of the patient.
Lab techniques to create and grow these embryos have dramatically improved. Dr. Stormont says that means fewer embryos can be used to achieve a pregnancy outcome.
There are guidelines from the American Society of Reproductive Medicine that in good prognosis patients, I transfer only 1 or 2. And I actually have to fill out a form if I transfer 3 to say why I transferred more than the standard.
The high price of in vitro fertilization has some couples only able to afford 1 shot at pregnancy. In many cases, they ask a doctor to implant at least 2 embryos and boost their odds.
There's a sense of desperation, and they say, we'll take our chances. And I hear all the time, we want twins, we want twins. I don't want twins.
If you save up that much money and somebody says, well, you have a 40% chance that one of the 2 will make it, so financially you have 1 shot.
Twins are more likely to be born premature, affecting their vision, lungs, and GI tract. These little boys beat major odds to survive a pregnancy that Anna was told had only a 10% chance of success after a medical scare at 21 weeks.
I was devastated, and I thought that things were not going well, and I thought we had a good chance of losing them.
The next few months were spent on bed rest to save the twins. Amazingly, they were born healthy at 36 weeks. The Landrys have 8 frozen embryos left over and are considering going through IVF again, but with a different plan.
I would be safe about it and probably only implant 1 if we decided to do it again.
What I anticipate in the next 5 years is that we get good enough to where transferring 1 embryo gives you a 50% chance of having a baby, and so you don't run the risk of having twins, and everybody's happy.